Good to go.
So our group worked on the mindfulness and DBT methods. And our group considers me, Jonathan, and Corinne. And yeah. So areas of interest. So that we're going to go through three major topics. So number one, about the population, understanding eating disorders, the risk factors and health risks, and then how our specific population, young adults and eating disorders, any specific things with that. And then number two is about the counseling theory, how mindfulness and dialectical behavioral therapy is in our lesson plans or session plans. And then lastly, number three, our rationale, why we use this theory with group work. So what are eating disorders? Which populations are affected, or what are the causes? So according to the National Eating Disorders Association, national surveys estimate that 20 million women and 10 million men in America will have an eating disorder at some point of their lives. And there are specific types, so as well. So who it caught, like, it doesn't really have like any specifics besides like eating disorders do not discriminate who the person is, such as their gender, religious background, age, race, ethnicities, body shape, sexual orientations, and weight. But there is no particular causes of an eating disorder, yet there is variety of factors related to them, which will be discussed in a later section. So, and also the eating disorders we are going to be focusing on is going to be anorexia nervosa, bulimia nervosa, and binge eating disorder. But some other ones could be orthorexia, other specified feeding or eating disorder, avoidant restrictive food intake disorder, pica, rumination disorder, unspecified feeding or eating disorder, and laxative abuse. So the possible causes, there are biological factors, a close family member with eating disorders or mental health conditions, history of dieting, and then negative energy balance. This is mainly when one burns more calories, and it can lead to this specifically. Typically, this happens when an individual's disorder starts with dieting and restriction of amount of food. So, and then going into the other factors, psychological factors, perfectionism is one of them, body image dissatisfaction, and then history with anxiety disorder, and then social culture factors. So there's a lot of stigma about weight in our culture, like the thin mentality, thinner is better. There is teasing and bullying, acculturation, and then limited social support systems. So the ones we are focusing on with anorexia nervosa, specific characteristics consider weight loss, trouble with maintaining appropriate weight. This depends on the person's age, height, and stature, and then negative body image. In some cases with this specific order, individuals can exercise in excess and purging by vomiting and sometimes using laxatives. And then the symptoms can have similarities with all of these eating disorders, but mostly it comes with like for emotional, behavioral symptoms, there's intense weight loss, making excuses to avert meals, concern about eating in public environments, severe fear of gaining weight, and withdrawn and secretive. For bulimia, there's specific characteristics for that as well. So it's a series of binging and other behaviors. For example, self-induced vomiting. So individuals with this disorder make themselves vomit to repair their binging episode. Or it's considered as like a compensatory behavior. Some emotional and behavioral symptoms is having more prevalent attitudes or behaviors about weight loss, control of food, and dieting. This individual may seem uncomfortable when eating around others, disappears after eating, skips meals, or have small portions of food, wears baggy clothing, withdrawn from friends and activities. And then finally, with binge eating disorder, the main characteristics with this is episodes of eating huge amounts of food. This will happen fast and to the point that the person is feeling intense discomfort and there's a lack of control. They usually feel shame or guilt afterwards. But also this doesn't mean they feel guilt for all these, for this specific disorder, but there's guilt and shame, negative thoughts, are with these others as well. So we'll talk about our population we're going to be focusing on, young adults and eating disorders. So rumination is higher with individuals who have eating disorders. It's like a specific form of repeating negative thoughts. In Rode et al. Study, they focused on young adults with binge eating disorder. These young adults displayed self-blame behaviors and caused specific individuals to gain more weight. Some other associated comorbidities include with eating disorders is depression, anxiety disorder, obsessive compulsive disorder, substance abuse, and personality disorders. There's a high level of emotional dysregulation, unable to tolerate these emotions. And then there's impulsive destructive behaviors, and then they have trouble with goal-oriented behaviors.
All right, so I'm going to talk a little bit about the overview of the counseling theory that we applied in the session plans. Ultimately, one thing that we will always kind of noted is making sure that we talk about the group norms every session, making sure that the clients coming in, they agree with the norms as well as adding any if they would like to, as we continue with the group sessions. We also want to implement mindfulness in every session, obviously so, because mindfulness is the topic of our discussion here. But we will be doing it different ways each one of the sessions, which you will see rather, as we continue on. And then the last thing that we always wanted to note, sharing resources to the members because they are going through eating disorders. We want to make sure that we give them an avenue, a place to kind of meet or resources to use after our sessions, because that's the most important part, is kind of continuating what we learn in the sessions outside of the sessions. So for the initial stage, we wanted to start off with mindfulness and its impact on interpersonal relationships. So the main thing that we're talking about here is a sense of belonging and trust, building that trust with amongst one another in the group, and understanding mindfulness in its simplicity. So kind of noting to the next thing is the introduction of mindfulness. This is what we'll do in the first session. We want the members to kind of know that mindfulness is an easy task to obtain, easy thing to do in their day-to-day. We will use mindfulness in the act of paying attention and remaining present. The possible conjunction of thoughts surrounding mindfulness specific to food and eating disorders will be one of the areas where we kind of start opening it up and allowing the members to express themselves amongst one another if the group members are feeling wanting to open up. And then also towards the end, just bringing everything back together, allowing them to kind of communicate amongst one another things that they've noticed, things that they felt, and pretty much just a real introduction stage of mindfulness and the impact that it can be on someone with an eating disorder. The next stage is the transition stage. We're pretty much going to identify the negative feelings with non-judgmental awareness, utilizing MBSR, which is mindful-based stress reduction. And a little bit more information about that is it's therapy. It's a meditation therapy. Its original design was for stress management, but it can help other varieties of illnesses and mental health illnesses. In this stage, we will also bring awareness to the current feelings and energy levels. We'll be utilizing the body scan activity in this stage. The purpose of this activity is for members to attune into their body sensations, improving their attention skills, promoting non-judgment and kindness to oneself, and attentional flexibility. We're going to really be focusing on or allowing the members to notice their sensations throughout their body, kind of gather their thoughts, notice their feelings, as well as everything kind of coming in. Um, we also, with this activity, we want to allow the members to explore their unhealthy behaviors and thoughts that might be comparable to other members of the group. So we're going to get into it a little bit, talk a little bit about the eating disorders, about some of the negative thoughts or negative behaviors that members might feel, not even associated to just the eating disorder, but just to be able to open up and share with other members of the group. And this will allow members to share with one another, and this, like I said, could help them greatly kind of tag team in this illness that they have that they're sharing. The next stage is the working stage, and here we're going to focus on exploring emotional regulation and interpersonal effectiveness. And this is also an introduction to journaling. So we want to focus on allowing the members to utilize these skill sets outside of our group sessions. So we're going to the first activity would be identifying feelings and sensations comparable to the last meeting that they had, with the implementation of journaling. So acknowledgement of feelings, saying that it's okay to feel these ways, both negative and positive, but allowing the members to get into journaling a little bit here. In this stage, the group leader will fall back a little bit of being the content communicator amongst members. Here, we're really looking for the members to communicate with one another, really utilizing interpersonal effectiveness, looking at other members to respond to body language or sharing things, kind of challenging other members, but also looking at things from multiple perspectives. But in this session, we really want the group leader to take a step back and allow the group members to really work amongst one another to really help each other out ultimately. Another activity is in the moment emotional awareness, and this is kind of the closing out of this stage. And in this area, the members are going to be looking to note their strengths and weaknesses as in the moment situations come up. So talking about kind of what in the moment means to them and the strengths and weaknesses and sharing them amongst partners. And then really, I mean, there is a little bit of mindfulness homework throughout, but this is really where we really kick into full on like journaling and looking for expectations of homework assignments being completed. And then the final stage is ultimately a commitment to mindfulness inside and outside of the group session. We want the members to be able to take what they've learned inside their session and utilize it outside their session. We want them to understand the challenges that they might face and stay committed to the mindfulness practices that we've taught them. And then be the open discussion of mindfulness strengths and weaknesses outside of the group, like the last meeting where we closed it off. And we're going to really come into final conclusion of the group, really noticing the strengths and weaknesses that we face and kind of preparing ourselves for what the members are going to be ready to get into as they continue on.
All right. And so our rationale for using group work in the treatment of this issue that we've been discussing, first of all, group therapy has been shown to be quite effective when working with clients who have been suffering from eating disorders. So the research suggests that a therapist-led group treatment for disordered eating actually led to higher rates of disordered eating abstinence and a greater reduction in disordered eating. Next, we have increased self-esteem for clients with eating disorders due to interpersonal experiences within group therapy work. And that research has shown that structured group therapy for this age group and this population with eating disorders has been shown to improve self-esteem with regards to perception of body shape and weight, and overall physical appearance. Early rapport and relationship building with members and leader increase effectiveness of mindfulness-based interventions. So developing trust and rapport in group settings has been shown to increase the effectiveness of mindfulness. And according to Yalom's research, the interpersonal interactions within groups are the most powerful agents of change. So mindfulness in conjunction with DBT in group settings presents a unique opportunity for clients. And mindfulness is the act of paying attention to whatever we're experiencing in the present moment. We're aware of what's going on around us in the environment, and we're aware of our thoughts, our feelings and emotions, sensations in our bodies, and our actions and behavior. And we simply observe these elements non-judgmentally and with acceptance, without reacting to or fighting against them. With DBT, there are 3 goals of mindfulness skills: to reduce suffering, such as emotional pain, tension and stress, and to increase happiness; to increase control of our minds instead of allowing our minds to control us; and to experience reality as it is and live life with our eyes wide open, to be present. There are 7 core mindfulness skills in DBT. The first is called Wise Mind, and it's a combination of emotional mind or emotion mind, where our emotions are in the driver's seat. We act based on what our emotions are telling us to do, and our thoughts are driven by our emotional states. The next one is Reasonable Mind, where reason and logic are in control. We act and think rationally and logically without the influence of our emotions. So Wise Mind is a synthesis of emotion mind and reasonable mind. When we're in Wise Mind, we're in touch with our emotions and how we're feeling, but we don't let our feelings and emotions control us. We act and we think rationally and logically while also taking our feelings and emotions into account. Next, we have what's called WHAT, DBT mindfulness skills, and that includes observing, describing, participating. So when we're being mindful, we observe, describe, and participate in whatever we're experiencing in the present moment. Next are the HOW DBT mindfulness skills, and that is non-judgmentally, one mindfully, and effectively. These are called core mindfulness skills because mindfulness lies at the core of DBT. They come first because they're the foundation.
All right. And these are resources.